Well, here we are with Dr. Wolski, a medical doctor who specializes in pain. He gets rid of pain, heavy pain. And he has two practices, one in Denton, Texas, and one in Dallas. Hi, Dr. Wolski.
Hi, Helmut.
Dr. Wolski, tell me, lots of, pain, that's why we most of the time go to the doctor, unfortunately, because we're not doing preventive care as much as we should. But what differentiates you from the normal, everyday family physician and even maybe from the normal, everyday pain management doctor? What makes your practice different and or special, if there is such a thing?
Well, we have a different approach to long-term pain. If people have long-term pain, a lot of doctors just treat that with pain pills. In our office, we have a multidisciplinary clinic, which means we have many professionals that'll help the pain. We've got MDs, we've got psychologists, we've got licensed counselors, we've got chiropractors, we have massage therapists and kinesiologists. And what we do is we have a program for chronic pain, which is usually about 20 to 30 days long. And these are for people who have long-term pain, they have chronic pain. We put them in the program, and it's an 8-hour-a-day program. And it's very intensive. These people have about 4 hours of counseling a day. They have about 4 hours of physical therapy a day. They have vocational planning to get them into a job. We teach them techniques on how to control their pain without taking heavy-duty addictive narcotics. And we do give mild narcotics if the patients absolutely need them. But we avoid very heavy-duty narcotics like morphine or OxyContin. Other things we can do are injections. We can do what's called epidural steroid injections for herniated discs. We can do ganglion blocks or blocks for reflex sympathetic dystrophy or complex regional pain syndrome. But that's kind of what sets us apart. We're CARF certified, which means we're the gold standard for this type of treatment. We get certified every 3 years by an independent accrediting organization. This is like an international certification, and what it guarantees is quality of care and that we follow a gold standard for patient satisfaction.
Wow. So what I'm hearing here, Dr. Wolski, is that it looks like you're trying to get to the cause of the problem rather than masking it with painkillers. Masking it with painkillers is probably a very fast, immediate relief of no pain. But like if you have a toothache, you can take painkillers all day long. Yes, the pain will be gone, but the tooth will still keep getting rotten, and eventually, no matter what, it will, so to say, blow up in your face. It's not fixed. And you are only using as much drugs as there is needed to make the pain, that the person can stand the pain, and then, however, you go and try to fix the real cause of where the pain comes permanently. Did I understand that right? Is that what your optimum goal is?
Yes, we always find out what the cause of the pain is. We do X-rays, we do MRIs, we do thermograms for RSD, bone scans. We try to analyze what the pain is, and we try to treat that and proceed from there.
Okay. Tell me, Dr. Wolski, what are some of the, just, the bulletin point, 1, 2, 3, what are some of the most common pains people do come to you in which you are very experienced in getting rid of?
The main type of patients we get are people who have had serious work injuries. Usually it's they've had a back injury or neck injury. lot of them want to prevent surgery, and pain management is a way to get them back to work and avoiding surgeries. A lot of them are failed surgeries, where they've had neck or back surgeries, or they may have had several. We had one patient had 8 surgeries.
Wow!
And each surgery they get worse. And what helped them was a pain management program that got their life back for them.
Well, this is wonderful, wonderful news, very informative news. I personally, for instance, have always believed that when the word pain management is out there, we're talking heavy drugs, but that just simply isn't true in what you're doing.
Well, what we try to do is taper people off of drugs. We've had patients on. We had one patient on OxyContin, and she told me. When we finally tapered her off of that, she said she didn't remember what happened the past 5 years. She said her grandkids would come up to her and say, "Granny, do you remember this? Do you remember that?" And she wouldn't remember any of it. She basically spent 20 hours a day lying in bed. And we were able to taper off her narcotics and get her stronger and give her counseling and get her off of that heavy-duty drug.
Well, that's great news. Dr. Wolski, thanks a lot for letting us know about it, and I'm sure we'll talk more. Bye-bye.
Okay.